The following is an original production of HCC TV, Howard Community College Television.
Joining me in the studio is the Program Director of Radiologic Technology, Assefa Fisseha, and the Program Director of Cardiovascular Technology, Bill Fisher. Welcome to the both of you.
Thank you.
Thanks for being on the show today. Assefa, we're going to begin with you. And I'd like you to tell us, what does the Radiologic Technology program prepare students for?
Well, we prepare our students to work as entry-level technologists. X-ray is like a science and arts. They have to know it, what the interaction between X-rays and a patient's body might be, but they have actually to do and produce image. They see a bone that they cannot see. They feel and sense and use landmarks to produce images in different directions, in different angles. And to qualify for that, they have to sit for the ARRT board exam and get Maryland Board of Physicians certification. Once they have all the certification, they can work in hospitals, outpatient facilities, and doctors' offices.
So there's many opportunities for students who are in this field then to work in a variety of settings.
Yes, there are. They can work different shifts, they can work different working settings, so there are plenty of opportunities.
All right, wonderful. And Bill, the Cardiovascular Technology program, what does that prepare students for?
Sure. The main goal of training students to work in the cardiac cath lab as invasive cardiovascular technologists, where they'll actually be working with a cardiologist performing various types of functions for cases that are diagnostic as well as intervention. There also will be assisting the physician in performing stents, coronary stenting, as well as valvular type of procedures to support somebody who might have some valve issues.
So the layperson may think that a doctor does everything involved in that, but the CVT, the cardiovascular tech, actually is very helpful in all that. Yeah,
the fact is that the cardiologist really couldn't do the job without the assistance from his team, and that would be from the cardiovascular technologist. It truly is a team approach.
Wonderful. Assefa, what academic background do students need to enter your program?
They need a basic high school level knowledge and skills in physics, biology, and mathematics. They need to be very hardworking and very determined to make it.
And a lot of them, I guess, once they graduate from our program, could be doing shift work, so they have, and again, long hours. So you prepare them for that in our program?
Yes, we send them to different shifts so that they can have a real taste of what happens in every shift.
So is there a direct correlation between what is being taught in the curriculum and what students need in the job market?
Yes, for every course we start with the theory class, and then it is followed by lab practice and simulation, and they have to perform competency in the lab before they start actually doing every exam with actual patients. So once they go to the clinical, they work with a registered technology. They start observing and then assisting and performing. So we prepare them from the very beginning, introducing them with the theory and lab simulation and actually working with patients.
So you must really work hard to increase their comfort level, that they get used to doing the type of work that they'll be doing once they transition into the real life situation?
Yes. It is like, it is done step by step. Okay, at some level they could be comfortable doing basic things, elementary things like extremities, upper and lower extremities. As we go forward, they're required to do more complex exams like OR and others.
I see. Okay. And Bill, you have the same opportunities for students who go through your program, and you have a variety of options that students can enter in your program. Can you tell us about those options?
Sure, that's correct. In addition to the associate degree option, students can also opt for what we call non-invasive option where they would prepare individuals to work maybe in a doctor's office or even in the hospital, maybe as a EKG technician, stress testing, Holter monitoring, and those types of what we consider non-invasive type of procedures. We also have the ability to offer individuals who are already working in a cardiac cath lab where they can essentially fast track right to our core cardiovascular curriculum. In addition to that, we also can fast track individuals who already have the respective professional credential, such as a nurse, maybe an x-ray tech or a respiratory therapist, or maybe a paramedic, to also provide them the opportunity to come right into the core cardiovascular curriculum again as a certificate type of option.
So for the experience, and I didn't know that, so for someone who's experienced and wants to get more credentials and therefore have more opportunities and advance in their career, it's good to get these different credentials.
Yeah, working in a cath lab, it's multidisciplinary. So there are individuals working in a cardiac cath lab, such as nurses and x-ray folks, as examples. But typically their curriculum through the respective programs don't offer the real cardiovascular component that's really necessary to be successful working in a cardiac cath lab. And so we can provide that opportunity for them.
So you provide the concentration, and the same thing happens with Radiologic Technology?
Once they finish X-ray, they can train or cross-train to other modalities like CAT scan and MRI are the most common ones where they can cross-train. They can take them in college, online, or in the hospitals. So
Bill, if someone's interested in the Cardiovascular Technology program, what would they do to find out more information?
They could certainly give me a call at area code 443-518-4466, and they can always email me at wfisher@howardcc.edu.
All right, thank you. And Assefa, for Radiologic Technology, what should potential students do?
Yeah, the same. They can call me 443-518-4296, or they can email me at fisseha@howardcc.edu. They can also contact admissions and counseling.
And that's probably a good resource for both programs, especially if someone's exploring health care options. They can go to the Office of Admissions and Advising and find out.
Absolutely. Yeah, we can actually talk more specific about the program and about the profession. But somebody actually getting started, maybe wanting to know about the process of getting started, and also maybe if there's any possibility for credits from prior college work to be transferred into the program, probably the admissions and advising folks will probably be the best place to get started.
That's a great suggestion. Well, thank you both so much for coming in to share with us the information about your programs.
Thank you.
Yeah, thank you for the opportunity.